participate. This sort of just next 15 or 20 minutes potentially perhaps is a bit dry, but it's probably appropriate just so that we know where we are at the moment and where we're coming from. And the democratising dementia in Wales, Sinead said, well, what the hell does that mean? What it actually means is the fact that at the moment, as we know, it's a bit of a postcode lottery about where you live in Wales, whether you'll get referred, who you'll get referred to, how long before you're seen, how thorough the assessment will be, how well the diagnosis will be given, and particularly what will happen then. And that cannot be right. And so I think, to me, the main aim of the Wales, maybe we should have called it All Wales Dementia Faculty, was to actually try and even things out so that there is good quality and prompt assessment and diagnosis everywhere. If we have the next slide. I've realised this is very unfair on Sue because she has to pay attention now to everything throughout. From now on, Sue, I'll do my own slides and then you can switch off. But for this one, thank you for doing them. OK, if we look at some of the policy documents, the Dementia Action Plan came out now 2 or 3 years ago. It's supposed to finish in next year, 2022. More recently, Rebecca and Michaela have been involved with generating the pathway of standards. And we've obviously got a new Welsh Government, Senedd, and mental health is certainly high on their priorities. After the last election to the Senedd, dementia was listed as one of the priorities. I'm slightly disappointed to find that dementia isn't actually specifically mentioned this time around, but hopefully that doesn't mean that it will have less of a priority. I've just picked out some of what seem to be the sort of priorities relevant to us on the right. Actually making a diagnosis, making sure that it's a positive experience, making sure that it's done thoroughly, and then it leads on to appropriate interventions and support. So all pretty obvious stuff, but those are the aims of government policy, and Michaela and Rebecca are, in a way, get their salaries on the basis that they will facilitate putting those into action. And I guess those of us who are actually working in the NHS also get our salaries on that basis, so we should be doing it. Next slide. Now, I'm sorry to sort of tell everybody the obvious, but the numbers of people with dementia in Wales is on the increase. If we go back to that slide, this is just over the next 20 years that there will be a 70% increase in numbers. Now, it will be nice to think that there's going to be 70% almost doubling in resources and services for people with dementia, but we have to live in the real world, and that may be being optimistic. So we have to actually make sure that we, at the same time as arguing for more resources, what we do is efficient and makes the most of them. Just in the next 5 years, the numbers are going up from 48 to nearly 56,000. So things are definitely on the increase. And the next slide I should say, just in answer to the question, these are obviously we don't know how many people will have dementia in 40 years' time. So these are guesstimates based on population numbers and projections. So these are fairly conservative estimates, actually, of the real numbers of people with dementia. And tying in with that, of course, dementia costs money, and it's the cost of these people will increase by more, double 70%. So about 157% increase in the next 20 years is the projection. A lot of that will be in social care, but also the cost to healthcare will more than double. So that's why, well, it's not the only reason, it's a major reason why new government is interested in dementia. And it's a card, we shouldn't speak like this, but it's a card that we do have to there to play. This is going to cost an awful lot of money to health and social services. So if we can do it better and more efficiently, we're saving money, and that's the sort of thing that people actually want to hear. Next slide. This is broken down by age group, and so when we say the numbers of older people with dementia are going to increase, actually what we mean is the number of very old people with dementia is going to increase. This increase in numbers is nearly all going to be in the very old, in the over 85s and over 90s. And people who are in their 80s and 90s have other challenges and other medical conditions. And so in a way, we can't just treat dementia in total isolation, divorced from everything else. So there is going to have to be much more joining up between mental health, older people services, because so that we can actually treat the whole patient rather than sort of different services pick off particular bits, and somebody will deal with the dementia, somebody deal with the stroke, somebody deal with the arthritis, somebody with the heart failure, and so on. That's really obviously not going to work and isn't very efficient. So our typical person with dementia over the next 10, 20 years is going to be in their 80s, 90s. They're going to have other morbidities with them. And that's the challenge. Now, if we go to the next slide. How does Wales compare with the rest of the country? Well, over on the left, the darker the colour, the greater the percentage of the population living with dementia. So we can see that Wales is all pretty dark, along with Cornwall, Devon and the southwest and East Anglia. That's partly because they are generally more rural areas. There were more retired people. The profile of the population tends to be older. In Wales in particular, the prevalence, the percentage of people with dementia is highest in Bro Morgannwg, and is lower in Cardiff and Newport and Swansea areas. And if we go to the next slide, what is perhaps all relevant here, you can sort of look at your particular health board. I'm sorry that Swansea Bay obviously has only recently existed, so all statistics at the moment still really refer to the old Cwmtaf Health Board and the old whatever it was, Abertawe Bro Morgannwg Health Board. As far as numbers, there we have in Betsy have about 4 times as many people with dementia as Powys. The other thing is that you see, for every 1 man, there are about 2 women, and that is, I think, what we all see in clinical practice. And that's a bit of a challenge because older men tend to are more likely to have spouses to look after them, whereas older women are more likely to be widowed and living on their own, and so don't have a live-in carer. So that's another challenge that we all have. Next slide. Now this is the blue bars here are the same bar as in the previous slide. The orange bars are the people with the diagnosis. So this answers, in a way, Dr. Sangal's point. The blue bars are the estimated numbers of people currently with dementia in each health board. The orange bars are those who have a diagnosis recorded anywhere in GP records. And GPs have been encouraged as part of their contract. GPs over the last couple of years have had to have a register of anybody with a diagnosis dementia within their practice. And that was a requirement of their contract and was also linked to potentially how much money the practice were given by the health board. So there was an incentive for GPs to actually make sure that anybody with a diagnosis of dementia was recorded. So this makes the point that, overall, only about half the people with dementia at any one time have a diagnosis recorded anywhere. And that is the basis for the sort of underdiagnosis of dementia that is of great concern to politicians and the public, and why there is the pressure to actually increase the numbers of people who have dementia, that they should actually have a diagnosis. If we go to the next slide. Here, again, these are the most, as far as I'm aware, these are the most recent figures available in Wales. Michaela, I think, said to me that they're working on trying to actually, and as part of the dementia standards, to get a mechanism where the numbers of people with a diagnosis of dementia, so the percentage who are diagnosed, can be sort of more easily obtained. In England, the numbers are published once a month. And so, in fact, you can go on to the internet and you can drill down to any particular practice, GP practice anywhere in England, and you can actually find the numbers of people with dementia. You can find the numbers who are estimated to have dementia. So you can track how things are going. And consequently, they're over on the right. We can see it in England, it's slightly over 2/3 of people with dementia are diagnosed. So that still leaves 1/3 who don't have a diagnosis. And it's roughly the same in Scotland, slightly better in Northern Ireland. In Wales, 3 or 4 years ago, I think David Cameron, I seem to remember, actually standing up in Parliament, and it was a very easy scoring cheap marks really against Wales about their relative underdiagnosis of dementia. Overall, in 2018, it was about 54%, so 13 or 14% less than in England. Now, it's not a competition, but if it were a competition, I'm glad to say that Cardiff and Vale would come out on tops. Still not as good as the English average, and obviously I had an interest in Cardiff and Vale, but that was perhaps because, as I say, we had a head start and deliberately had a mechanism where there was very easy way for people to refer people. We don't refuse people. We don't make demands that they must have had this, that, and the other assessment before they'll be seen. And consequently, Cardiff and Vale has the highest proportion who are diagnosed. Powys and Hywel and Clontarf are sort of down the other end, and I think that reflects, I think, the fact that until recently, dementia has not been as big a priority in those areas, and there haven't been, and still aren't probably, as many staff members and professionals around. So, but things are improving. If we go to the next slide. Yeah, this is just looking at all the literature. Well, why is there this underdetection? It's one answer would be, well, maybe people don't want to be diagnosed and don't want to be found, but that doesn't seem to be borne out by the literature or any research. The people are less likely to be diagnosed overall if they are living in the community rather than care homes. Well, it's very easy in a care home, and as we know, go into any care home and the great majority of people these days will have dementia. So if you want to bump up the numbers of people with a recorded diagnosis of dementia, a quick and easy way is to go around all your local care homes and just make sure that everybody who has dementia in the care home has the diagnosis recorded. And in fact, that's what they did in Northern Ireland, which is why Northern Ireland consistently actually end up with the highest proportion of people who are diagnosed. I certainly would not encourage anybody to spend a lot of time doing that, because I don't really know of that much evidence that somebody who has settled and is living in a nursing home is going to be particularly advantaged by having a diagnosis of dementia recorded. On the whole, what people in the care home need are practical support, and they will be getting, hopefully, the appropriate support, whether they do or do not have a label of dementia. I think what's more important, that they should have been diagnosed 5 or 10 years before, and they should have been diagnosed when they were in the community. People are more prepared to diagnose people in their 80s and 90s, because there's the assumption that anybody who is a bit forgetful, oh, well, that's probably dementia, whereas people in their 60s and early 70s, there's more reluctance to diagnose dementia. There's more reluctance to diagnose dementia in men, people from more deprived areas, lower socioeconomic status, are less likely to have, first of all, to come forward to services, but also less likely to be judged to have dementia. And not surprisingly, if GPs are less likely to diagnose than specialists. If you're being referred to a specialist, well, I guess the specialist is much more likely to come up with a definite diagnosis. Interesting, it's worth saying that there is very good data showing that if a GP judges that a patient has dementia, then more often than not, they do have dementia. So GPs do not inappropriately label people as having dementia. However, GPs miss a lot of dementia, so they are not very sensitive to picking up cases of dementia, but they are specific. So if in a referral letter it says, this patient, I'm concerned that they are developing dementia, I feel that they have now have mild dementia, then interestingly, they'll usually be right. However, if they are a bit dismissive, that judgment isn't quite so good. Yeah, Louise is just making the point that a diagnosis of dementia is not desired in some care homes, as it creates difficulty about the registration status of that care home and the limits on numbers of residents, which is absolutely true. It's obviously a stupid anomaly of the service. But interestingly, in Northern Ireland, there's a slightly different system, so it's not actually an issue there. Yes, but we shouldn't have a service where people's diagnosis is decided by the way things are administered rather than what is in the interests of the individual patients. So we are up against the system that exists rather than one that we'd actually want. I certainly, I'd repeat, I would not encourage you to actually go into care homes deliberately to actually try and raise your proportion of people within your area who have the correct diagnosis. That having been said, if you are asked to see an individual in a care home, then I think they most definitely deserve to have an appropriate diagnosis that will help them. It has to be said that sometimes I've labelled people as having cognitive impairment, significant cognitive impairment, rather than using the D word for the very reason that Louise says, that immediately I mention the D word, that would mean that there were problems and there'd be suggestions that perhaps the patient should be moved to another home, or there was a problem with the numbers in the home. So it is a real issue. Let's just have the next slide. Now we're back to the number diagnosed. Again, this is just actually perhaps for each of you to look at your own health boards. Whereas, say, in the old Abertawe Health Board, over the 5 years, there was a 10% increase in the proportion of people diagnosed, as there was in Cardiff. Unfortunately, in, say, Powys, in fact, the proportion even slightly fell. So there is, a lot of work for us to do, particularly because to be honest, I'm not sure if it still does exist anywhere. I think in the, from memory, in the Dementia Action Plan, in the end, it was saying that there should be a 3% increase year by year in the proportion of people diagnosed with dementia. Rebecca's about to agree or disagree with me, I think.
Agreeing, Tony, agreeing.
Okay, yeah. Which I don't think anybody could argue with. The advantage we have at the moment is that it's not actually measured, so nobody can know whether there is 3% on or not. But that is about to change. So we can be, we can have a baseline where we are now, and the aim is to, in 12 months' time, for the health boards to be 3% better than they are at the moment.
And of course, that's going to look very different with the death rates from COVID as well.
Yeah, which is a great link, because if we go to the next slide, there is this sort of COVID effect that we're not quite sure how that will work out. Now, these are English figures because, as I say, it's not possible at the moment to get equivalent Welsh figures. But COVID has had a disproportionate effect, as we all know, on people with dementia, particularly people with more severe dementia, and particularly people in care homes. And so that has slightly changed things. It has not changed things dramatically, and we just have to bear that in mind. We're talking about changes by a couple of percent rather than changes of sort of 30, 40, 50%. I say these are English figures. Over on the top right, the green line, there was the I can't remember whenever COVID started. It was in the 12 months before COVID, whereas the red line is sort of post-COVID. So the diagnosis rate has gone down. That does mean the prevalence has gone down. But the graph on the left is the red line was the rate at which diagnosis was being made immediately before COVID, and then that compares with the green line. So in England, the numbers of referrals and the diagnosis rate and therefore the recorded prevalence have all fallen, and I think it's reasonable to assume that the same has happened in Wales. And certainly, as we'll know, most memory services have got an increased waiting list at the moment, and have to actually catch up with, or I was going to say the post-COVID. We don't know whether we are post-COVID yet. Hopefully, things will settle a little bit more now. So there is a catching up to be done, as well as an improving on what we were doing pre-COVID. Next slide. And just to sort of make matters worse, we also don't actually know the effect of COVID on dementia risk. The over 65s were much more likely to much more likely to have COVID, and at least this is figures from I think the end of last year, after the first wave, beginning of this year. It would seem that people who have had COVID, so the red line, are more likely to actually have a diagnosis dementia in the subsequent 6 months than people who did not have COVID. And in fact, the blue line is controlled for people with any non-COVID respiratory infection. So there's a lot of talk about long COVID. We know that COVID does seem to have increased risk of stroke, cerebrovascular disease. Over on the right, that's comparing people who had delirium and who did not have delirium associated with COVID. And again, perhaps not surprisingly, if you had delirium associated with COVID, you were much more likely to subsequently develop be diagnosed with dementia. So it is possible that although there are fewer people who have with dementia because they died prematurely, but that reduction in numbers is going to be compensated for an increase in people with new diagnoses dementia, which have been brought on probably earlier than they would have by COVID itself. And then there's also the issue is that a common complaint of people recovering from COVID is not being able to concentrate correctly and having memory problems and brain fog and however we call it. And I think some of those patients are just beginning to trickle into memory clinics. So we have the challenge of distinguishing people who have sort of non-dementia consequences of COVID, but there is also this signal that there may be an increased risk of dementia. And Anne-Marie's question of less referrals coming. Yes, there were less referrals, but in England and certainly in Cardiff, the referral numbers have gone back up to normal rate over the last 2 months and are in fact slightly increasing. So the quiet period of referral, if it was that post-COVID, may well be over, and the backlog is coming forward now. So there is, before COVID, there were large numbers of people who were not being diagnosed with dementia. When they were being diagnosed with dementia, they were being diagnosed too late, and they were being diagnosed often after an unreasonable time to be seen within specialist clinics. Post-COVID, we are in this slightly uncertain period when things are settling back, and COVID may itself have a knock-on effect on referral numbers and numbers needing to be assessed. So we have to actually think of all these things. And Judith is just saying that, in Betsy, the referral rates are on the up again. I think the good news is that nobody's going to be out of a job because the demographic changes, impact of COVID on the disease itself, and the backlog created by COVID have all been are going to have an impact. The concern is the fact that, as we know, the government doesn't have lots and lots of money to give away and is going to have to claw it back from somewhere. And I think within Wales, the danger is that there'll be a feeling that, well, the government gave 10 million extra money to with the Dementia Action Plan. They've recently given another, I think it's 3 million. They're not going to be scattering lots and lots of money at dementia. So we can argue for more resources, but we've got to be realistic that there's not going to be a 157% increase in resources to address the costs over the coming years. Same in Michelle's just saying that the same increase in numbers in Clwm-Taf. Okay, that's my last slide, just in a way setting the scene with the numbers.